Hello everybody, this is Margaret Harris at WHO Headquarters Geneva, welcoming you to this, our very first virtual briefing on global health issues for 2025.
Last year, we responded to 51 emergencies in 89 countries. Conflicts, outbreaks, climate-related disasters, and more. In 2025, WHO estimates that more than 300 million people will need urgent humanitarian assistance. Today, WHO launched its annual health emergency appeal with an ask of $1.5 billion to support our life-saving work for the emergencies we know about and to react swiftly to new crises. We thank the many donors who have supported WHO's work so generously in the past. Once again, the world's most vulnerable people are depending on us and depending on you for help and hope. Last Friday, WHO received reports of suspected cases of Marburg virus disease in the United Republic of Tanzania. So far, 9 cases have been reported, including 8 deaths in 2 districts of the northwestern region of Kagera. The region is home to animals that are known to be reservoirs for the virus, including fruit bats, and there was an outbreak of Marburg in the same area in March 2023. National rapid response teams have been deployed. A mobile laboratory is in the Kagera region, and treatment units have reportedly been established. WHO is supporting the government, and we have offered to provide any further support needed. We encourage the government to send the samples it has collected to international reference laboratories and to collect additional samples in accordance with normal procedure. WHO rates the risk as high at the national and regional levels and low at the global level. We have issued advice to prevent further transmission of Marburg, to provide care for those infected, and to control the outbreak. We recommend that surveillance should be strengthened at relevant points of entry and in border regions in the United Republic of Tanzania, and that neighboring countries enhance their readiness for detecting, isolating, and treating cases. At this time, WHO advises against restrictions on travel and trade. Now to the global spread of H5 avian influenza. Last year, 66 cases of H5 were reported from the United States, plus 10 from Cambodia, 2 from Vietnam, and 1 each from Australia, Canada, and China. This is the highest number of reported human cases since 2015. So far this year, 2 cases, including 1 death, have been reported in the United States and 1 death in Cambodia. Almost all these cases are associated with infected dairy cattle or poultry. H5N1 is of particular concern because since the first human cases were reported in 2003, it has killed almost half of those it has tracked. Fortunately, H5N1 has not yet developed the ability to transmit easily between humans, but that could be only a matter of time. Every transmission from one animal to another or to a human is an opportunity for the virus to mutate or to mix with other influenza viruses. It's therefore imperative that the virus is not allowed to spread unchecked in animals. WHO is working closely with the World Organization for Animal Health and the Food and Agriculture Organization of the United Nations in a One Health approach to managing the threat of H5 globally. We call on all countries to strengthen biosecurity on farms, testing and surveillance, and to provide personal protective equipment to farm workers who may be at risk. We also call on all countries with outbreaks of H5 among animals to share viral samples and sequences with the WHO Global Influenza Surveillance and Response System, or GISRIS. Finally, this month, many countries around the world are raising awareness about cervical cancer. Cervical cancer is the fourth most common cancer in women globally, with an estimated 660,000 cases and 350,000 deaths each year. And yet, cervical cancer is one of the few cancers that can be prevented and cured if detected early. Most cases and deaths occur in low and middle-income countries that lack access to vaccines, screening, and treatment. On the 17th of November 2020, WHO launched a global initiative on cervical cancer elimination. Since then, dozens of countries have introduced vaccines to prevent the disease, and many are also rolling out next-generation diagnostics. Eliminating cervical cancer is within reach. If we can give all girls and women access to vaccines, tests, and treatments. Preventing cervical cancer is one dimension of WHO's work to promote, provide, and protect maternal health, which we have chosen as our theme for World Health Day this year. Margaret, back to you.
And we have one last follow-up from Rachel Carlson, NPR. So, Rachel, please unmute yourself and ask your follow-up question.
Thank you. I wanted to ask why there have been more Marburg outbreaks in recent years.
Very good question. I'll ask Dr. Abdi if he's got some theories.
Thanks. I think that's the million-dollar question that we need to all work together, and it relates to what DG said, how we need investment in preparedness and the pandemic accord. Definitely emergency will happen, and we need to be prepared. In terms of specifically where we are seeing more and more outbreak, particularly three things relating coming together: the ecology of the viruses, the human behavior, and the economic situation that are happening here. So viruses have been there, and they will be continue. But recently in East Africa and Central Africa, particularly the outbreak we had in Rwanda, the 2023 outbreak in Tanzania, and the suspected Marburg outbreak that's going on currently here. So we are seeing as more people go out into births area, as more virus laboratory surveillance improve, we will be detecting more outbreaks that's going to happen. That's part of the nature. What we need from us is that preparedness and the readiness required, and the timely and the transparency sharing of information, so that what saves is early detection, early care. Rwanda has proven that although usually previous Marburg outbreak had a case fatality rate around 80%, when early treatment and early detection happened, they were able to reduce the case fatality rate. So just to reiterate again, we live in a world that's changing, climate change, all that thing, it will be there, but we can prepare so that outbreaks doesn't need to end up large outbreak like the West Africa Ebola outbreak. So early detection, early response saves life, and timely information sharing with WHO, with member states, will always save lives. Thank you.